This session was about discussing different pathways to access diagnosis, treatments, clinical trials, and the patient experience in general in different regions and in different countries all over the world. And the session just reflects the disparities, the enormous inequalities that we see across regions, and how, for instance, in low and middle income countries, there are significant barriers still to access diagnosis, the most simple elements for a good diagnosis on CLL, and recognize the different characteristics of the disease that allow to match with good treatments available. So it's not only the barriers that, of course, they also have to access these treatments, but it's that everything starts from the moment to diagnosis. So it's the delay to get diagnosis for the patients, the different barriers associated also to the connections, from the patients to public healthcare systems. We saw, for instance, interesting data from Brazil and from Argentina, talking about different outcomes depending on where the patients were treated, if in public hospitals or in private hospitals. Sadly, in countries that do not have access, the public system is not well equipped because the lack of financial resources to really fund the system as it should be. And from Lymphoma Coalition, we participated by bringing data from the global patient survey on lymphomas or CLL. Here we presented a abstract data code focused on CLL for patients on different topics. We first presented the expectations for the treatments that patients have when they are first offered a treatment. Acknowledging the lack of curative treatments, patients prioritize together and very close one to the other remission, survival, the better opportunities, improved survival, and quality of life. And I want to call your attention because in the conference, I haven't seen yet any data on quality of life presented. Everything has been focused on clinical outcomes. We need to really pay attention to what patients need, what are the unmet needs, and sometimes are not only related to the disease, but are more related to the patient well-being, the patient opportunities to have, if not a full life, at least a life that can help them move forward and be happy. And we presented also the barriers to access clinical trials. It was significant that 76% of the European patients reported never being offered access to clinical trials. This is massive, but it's not really far from other regions. And we here would need to explore more granularity on the data to understand the differences across countries and across regions, because there are countries that sadly do not have clinical trials available, but there are countries that having clinical trials available, still the patients are not referred to this. Sometimes it's because the inclusion criteria does not really match the criteria, the situation of the patients in real world. So there is a gap there that doesn't welcome, let's say, patients from real world in the restricted inclusion criteria of some clinical trials. There are also geographical restrictions, barriers for the patients to access. There could be also lack of awareness or full understanding of the trials and what the trial offered from the healthcare professionals, but also there are, and we have seen this through other work that Lymphoma Coalition does in the community advisory boards and also by reviewing protocols for clinical trials. We see, let's say, that opportunities for improvement in the design of the clinical trials to reduce as much as possible the burden for the patients, not to make them live things that won't bring any value for them, and to have very realistic viewpoints on the benefits and the quality of life they may expect from the trials, and trying to answer in those uncertainties. And last but not least, we explore also the communication gaps. There are still significant communication gaps across all regions, but are especially significant in Asia. And there are cultural beliefs, issues behind that, also paternalistic models, also the different forces in the dynamic of the doctor-patient relationship. But what we stress also, and we did this through questions, pool questions with the audience, and then I had the opportunity to tell what we have seen in our data, is that even for those patients who recognize good communication, let's say satisfaction with the communication with their doctors, still it's acknowledged that the doctors don't always allow the patients to speak without interrupting. So it's like constant interruptions what diminish the quality and the effectiveness of that communication. And the need to confirm with the patient that what they understood from what the information that the healthcare professionals have given is accurate, is precise, and really reflects what the doctors wanted to transmit to the patients. And those only to mention a few of them. But I invite all of you to really follow up on the data from this global patient surveys. I think that the first high-level analysis will be released by October. And so we are really close to have this available, but also we will be presenting for sure this data and interesting insights in future conferences at ASH.